let's start by breaking a myth that's really hurting a lot of people. Most patients are going to walk out of their doctor's office relieved when they hear the words normal. Your labs are normal. But the truth is, normal is not optimal. Now, normal just means you're not sick enough yet to qualify for a diagnosis, which then in turn qualifies you for some type of intervention.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Welcome to the show. I'm Dr. Alessi. Answer this question. When was the last time you felt amazing? Wow, it's been that long, huh? What are you giving up? What might you be missing out on? If you could change that, would you take action? You know, your health isn't just another trend. It's your ability to experience and enjoy your future. Let that sink in. Being there for your family, doing the things you love to do with no limits, not wondering if something bad is going to happen. Well, if you're ready to stop guessing and start healing, this is your sign to join Total Care, a revolution in how we view and approach living healthy. Visit AlessiFunctionalHealth.com, go to services and click Total Care to claim your exclusive podcast listener discount as well as a free gift. Now, enjoy the episode. Welcome back to another episode of Health Decoded. I am your host, Dr. Alessi. I'm excited to have you with me today. Going to really dig in on this one and get to a topic that a lot of people are kind of hung up on right now. And I think there's a lot of back and forth, things you're seeing online, maybe things you're hearing from your doctor or from friends and family. And I just want to cut through the fluff, cut through the nonsense, and ultimately tell you guys the truth, and ultimately dig into this topic today of why your blood work is lying to you. And so what we're going to break down, we're basically going to go through 4 segments here. Number 1, why normal, I'm air quoting, normal labs don't mean optimal health. Segment 2, the danger of waiting until you're sick. Segment 3, the functional ranges that actually matter. And then segment 4, how to get the right labs and then what to do with them, take action. So, if you've ever been to your doctor, you've been told that your labs are normal, but you still don't feel well, this episode is for you, because here's the truth. You're not healthy. You're just not sick enough yet. And so modern medicine is designed to wait until there is a diagnosable disease, illness, pain, whatever it may be, to take action. So we're all about proactive health. We're all about getting ahead of the problem. And that's what we're educating on here today is how can you take control, become your own doctor, and ultimately make the best decisions for your health and your family's health. And so if you've enjoyed this show, if you like the content that you're hearing on here, if this episode resonates with you in any way, please share it. Please subscribe to our page so you don't miss anything that's coming out, and share this with someone who needs to hear this message and needs to be more informed. We appreciate that. So let's just get right into it. Again, why having air quote normal labs don't mean optimal health? Well, let's start by breaking a myth that's really hurting a lot of people. Most patients are going to walk out of their doctor's office relieved when they hear the words normal. Your labs are normal. But the truth is, normal is not optimal. Now, normal just means you're not sick enough yet to qualify for a diagnosis, which then in turn qualifies you for some type of intervention, often medication, injections, surgical possibly if it's a joint related issue. And that's just a whole downstream of follow-ups and doctor's visits that most people go through with a ton of frustration. Now, just to iterate real quick, we are not anti-medicine. We're not anti-medical doctors. We just are anti the wrong thing at the wrong time. And we're all about the patient first. The patient needs to be looked at as a whole and really understand what is the pathophysiology causing said illness, disease, or symptom, right? If it's not full blown yet. And so, the normal ranges that doctors use and test for, they're not based on what's healthy. They are based on a statistical average of people who are getting blood work. That's it. And that population includes a ton of people who are overweight, inflamed, diabetic, or already sick and unhealthy. And so these reference ranges are not targets, they're statistics. For example, take a marker like TSH, that's thyroid stimulating hormone. Most labs will say the normal range is somewhere between 0.4 and 4.5. But in functional medicine, we know the sweet spot where people actually feel good is around 1 to 2.5. When you get outside of that tighter window and more to the outsides, the highs and lows of that reference range, people tend to have symptoms. But again, in modern medicine, if it's within reference range, they're not going to diagnose you. And so that's not just an opinion of ours, that's data. A 2022 review in the Journal of Clinical Endocrinology found that patients with TSH levels in the high normal range above 2.5 were significantly more likely to experience fatigue, weight gain, and depressive symptoms. Now, here's another one, fasting glucose. This is one we talk about all the time because metabolic health is so critical. Doctors will tell you, hey, anything under 100 is fine, but 99 isn't fine. That is the cliff. That's what we call the metabolic cliff. Multiple studies show that people with fasting glucose above 90 are at an increased risk for insulin resistance, inflammation, and cardiovascular disease, even before a diagnosis of prediabetes. In a 2020 article from Diabetes Care, researchers showed that even glucose levels in the upper 80s were predictive of long-term metabolic dysfunction. The upper 80s, again, that's what most docs would consider okay, healthy, right? Normal. So one more, and I'm going to use some statistics here as well. Let's look at vitamin D, chronically low levels in this country. And so the normal lab range starts at around 30 nanograms per milliliter. But optimal function for immunity, energy, and inflammation actually happens closer to like between 60 and 80. So if you're walking around with a 31 and you're told, oh, you're within range, you're fine, it's missing the point entirely. Because here's the bigger issue. Again, conventional medicine waits until you're diagnosable, until your labs are basically screaming disease. But functional medicine is about spotting those whispers, the subtle dysfunction before it becomes disease. Because that's when we can actually intervene, reverse, and restore. And so the takeaway here is that you're not broken. You're just being measured by a broken system. We need to stop measuring the way that we have been and start focusing on everything that goes into that person that we're looking at and talking about. And so let's get into the next piece here, the danger really of waiting until you are sick. And so it's often a lot harder to fix a problem when it's been going on for a long time. See this all the time with our joint pain patients who come into the clinic. Yeah, I felt the pain start about 10 years ago and, it wasn't too bad. So I kind of just let it go. Now, by the time they've come in and actually taken action to get some x-rays or some type of evaluation, the degenerative arthritic process has gone so far down that it's often a lot more difficult to fix if we even can help the patient at that point. So again, it's always easier to fix the leak at the start. And so, let's get real about the way that conventional medicine works. This is the way that the system was designed, is to manage disease. There is a lot of money in managing disease because it doesn't fix the problem, right? If somebody had to come out to your house every day and you had to pay them to patch a leak, they're going to keep charging you. What if they just fix that leak, right? And so that's the caveat there between functional medicine and conventional medicine. Conventional medicine is highly reactive. It waits until the house is burning down before you reach for the fire hose. And so here's kind of the playbook, right? If we're talking about an example like blood sugar dysfunction and diabetes, wait until your A1C hits 6.5. Okay, now you're a diabetic. Wait until your TSH hits 5.0. Okay, now you qualify for Synthroid. Wait until your cholesterol is through the roof. Okay, now it's time for a statin. But let me ask you something and really think about this. What happened in the 5 to 10 years before that diagnosis? Well, your body was talking and nobody was listening, right? Oh, it's okay. Let's just wait until this gets worse. Or, hey, follow up in 6 months. Let's see if this takes a downturn and becomes something we need to take action on. Diseases don't strike overnight. That's just not how they work. It builds slowly, silently, systematically. And your labs don't jump from perfect to pathological in a week. There is a decade-long window, what we call a smoldering phase, where dysfunction is building. But it doesn't look bad enough on paper to sound the alarm yet. So if you're told you're fine, even when your fasting glucose has crept up into the 90s, your TSH level is edged up into the upper 4s, your HDL is dropping and triglycerides are climbing, right? But you're exhausted, you're gaining weight, and you're told you're normal. Everything looks fine. Just keep doing what you're doing is what you're told. There's a term for that in psychotherapy. It's called gaslighting. And that's literally what's going on. I mean, we do it to our kids all the time. They fall down. Oh, you're fine. They don't look fine. They just fell, right? They don't feel fine. And so when someone tells you you're fine when you're not, it's gaslighting you. It's not really helping you or managing anything. It's lazy medicine. There was a 2019 study in BMJ Open Journal that revealed that over 60% of patients with early symptoms of chronic disease were dismissed as normal by their primary care provider in the 12 months prior to their diagnosis. That means a whole year went by where nothing was done, even though they were told they were normal and that disease was coming. It's basically like, hey, wait around another year feeling like crap, and then let's do something. Again, that's not healthcare. That's healthcare lag. And that's what we are upturning with what we do in our clinics and our systems. We see this all the time. You know, patients who have been dismissed for years, they've seen all these different doctors, they've had a million different tests, yet the symptoms are chalked up as, oh, you're just getting older. Oh, you're just stressed. Oh, you just have anxiety. And then they're given drugs to mask the symptoms. Why? Because the system only acts when you're sick enough to code for billing. I keep using the word system because that's what it is. The insurance company, the medical system, it is highly related and connected, and everybody at the top is making money on you staying sick. And so in functional medicine, we do it differently. We're not waiting for the fire. We act when there's smoke, right? Something's starting to get a little hot. We're going to jump on that. And we catch the trends. We spot the dysfunction before it becomes disease. That's what we call root cause healthcare. And frankly, that's what you deserve. And that's what everyone should be doing. That's how the medical system should be. We wouldn't have hospitals and doctors' offices booked months in advance for something that could have been prevented years ago. And so, you know, by the time conventional labs catch your issue, the damage is already done. So we're here to catch that decline before it becomes a disaster. Now, let's get into the functional ranges and some of the biggest things we're going to look for and a little bit more nitty gritty detailed stuff. But real quick, let's take a word from one of our sponsors.
This episode of Health Decoded is brought to you by Authentic Nutrition, the brand redefining what it means to fuel your body the right way. At Authentic Nutrition, they believe that what you put into your body matters. That's why every single product is crafted with clean, premium ingredients and dosed with maximum efficacy to ensure you're not just meeting your health goals, you're exceeding them. No fillers, no shortcuts, no gimmicks. Whether it's their advanced supplements for energy, recovery, or gut health, you can trust that what's on the label is exactly what's in the bottle. Authentic Nutrition delivers science-backed formulations that work as hard as you do. If you're tired of products that promise the world but don't deliver, it's time to make the switch to Authentic Nutrition. Elevate your health with transparency, quality, and results you can feel. Check them out today at AuthenticNutrition.com and use promo code Alessi15 to get 15% off. That's THENTIC Nutrition.com, promo code ALESSI15 to save 15% and take the first step toward real, lasting health. Authentic Nutrition. Fuel your best self. Now back to the episode.
All right, welcome back. Let's talk now about the functional ranges that actually matter and what to look for. So if normal ranges that we just discussed aren't cutting it, what do we look for then in functional medicine? We use what are called functional ranges. Those are the zones where your body actually performs at its best. Not just not diseased, but actually vibrant, energetic, metabolically healthy. So let's walk through some of, a few of the more important ones that we're going to look for and we actually utilize within our total care program at Alessi Functional Health. Number one of the biggest that gets misdiagnosed and missed is what we discussed earlier, TSH. And so most doctors are going to run a TSH hormone test and they consider anything from 0.4 to 4.5 normal. But again, that's not optimal. That's statistical. What is the functional range for TSH? Somewhere between 1 and 2.5. Now notice that's a much smaller range. People feel best in that zone. That's stats based on data. And outside of it, we often see the symptoms creep in: fatigue, brain fog, metabolism issues, even if that conventional range is reported as normal. We also then take it a step further. We're going to look at free T3 and free T4 to see what your body actually has bioavailable to use. We're going to look at reverse T3. That's basically the metabolic brake pedal that, when it's too high, can lead to blocked metabolism. Then we're going to look at TPO and TG antibodies. These detect Hashimoto's before it takes over. That's an autoimmune condition. Journal of Thyroid Research, a study done in 2020, showed that 40% of patients with normal TSH still had clinical hypothyroid symptoms and improved with treatment based on functional labs. So again, that's a big number, 40%. Now, next thing we're definitely going to focus on is blood sugar, glucose and insulin. Again, conventional medicine says fasting glucose up to 99 is fine or normal. An A1C up to 5.6% is non-diabetic. But here's the problem. At 90 to 99, insulin resistance has already begun. And insulin resistance is the gateway to weight gain, fatigue, hormonal disorders, heart disease, and even cognitive decline. Alzheimer's disease is now widely known as type 3 diabetes. However, it starts years before any symptoms. So what's the fasting range we want to look for fasting glucose? I apologize. What is the functional range we want to look for fasting glucose? Somewhere between 75 to 89. And even better, we're going to take it a step further again and test fasting insulin, which most doctors are going to ignore. If your insulin is creeping above 7 to 8, your metabolism is already under stress. And so the American Journal of Cardiology in 2017 confirmed that fasting insulin is a stronger early predictor of cardiovascular disease than fasting glucose or A1C. Now, this is a test that's not even being run. So that goes to show you. Now, what's next on the list? Inflammation and immune function. So conventional testing for inflammation highly misses the mark. They really only flag things like CRP, which is C-reactive protein, or ESR, which is your erythrocyte sedimentation rate. And if they're sky high, they're obviously going to look at those. But low-grade chronic inflammation is the root cause of so many things like autoimmunity, pain, fatigue, hormone or gut dysfunction. And so the functional range of CRP is less than 0.5. Even like a 1 to 2 is a red flag in our clinic. We're also going to test things like homocysteine, which is linked to methylation and detox issues as well as cardiovascular risk. We're going to check ferritin. If it's too high, that could be hidden inflammation, which is often missed. And then white blood cell trends. Low to normal often signals immune suppression from stress. We also run a very, very indicative cardiovascular focused inflammation panel that many doctors are not going to look at. Honestly, if you told a medical doctor, they probably don't even know what it means. We look for 3 things: a PLAC, which is a plaquing score, an MPO, which is myeloperoxidase. It's an enzyme that your heart and your coronary arteries produce when under stress or inflammation. And then oxidized LDL. Is the LDL in circulation being oxidized and becoming highly reactive? If one of those 3 things are high, that is a red flag. If all 3 are high, it's immediate action. Now, the next thing we would look for is liver function. So you'd be surprised how many people walk around with early liver stress without a diagnosis. The conventional ranges of ALT and AST, which are your liver enzymes, the conventional range goes up to about 40 to 50, depending on the lab. The functional range that we want to see is somewhere between 10 to 26. Anything higher than that, it is a sign of high toxin load, fatty liver, blood sugar issues, possibly over medication, or leaky gut. And remember, the liver is the MVP of hormone balance and detox, so you cannot ignore it. That would be like the filter, the air filter in your car, not being clean. So why do these functional ranges matter? Because number 1, they allow us to catch early dysfunction before it is full-blown disease. We can then create custom protocols based on the individual, and we can monitor progress in real time with advanced lab testing. And so it's also going to give you some peace of mind that you're not crazy. You're not living with symptoms that are just, again, air quote, normal. And there is something going on. It's early dysfunction. And so most people who feel terrible and have labs that are conventionally known as normal, their body is starting to functionally fail. So when you use the wrong map, it's a great analogy. When you use the wrong map, you get lost. And most doctors are using a map that was drawn by insurance companies, not physiologists, right? And so we don't guess, we really measure and go into detail. You can ask any of our patients how much detail we go into on our testing. Now, how do you get the right labs? And then what do you do with them? All right. So, again, how do we do it differently? And what can you do right now? Again, if any of this is resonating with you and it's been going on for some time, that's far too long. What can you do right now to take action? Number one, test, right? Stop guessing. Stop wondering if it's going to go away. Test it. In functional medicine, we don't wait until things are broken. We test your entire physiological terrain so we can catch the dysfunction early and fix it before it becomes a disease. So the Alessi Total Care Blood Panel, this is a custom panel that we created, looks at all these things and even some more. So it's going to look at a complete thyroid panel, everything we talked about earlier, TSH, free T3, T4, reverse T3, antibodies. We're going to look at a full blood sugar and insulin panel, fasting glucose, insulin, A1C, HOMAIR, which is a insulin resistance score. We're going to look at inflammation, CRP, homocysteine, ferritin, the cardiac inflammation markers I discussed. We're going to look at full lipids, and we go even deeper. We want to see if there's oxidation, hormones, basically an entire hormone panel. And then we're going to look at nutrient levels, B12, folate, magnesium, zinc, vitamin D, all of those. And so we're basically casting the broadest net to take a proactive approach to see if there's anything we can catch early. Now, we can even add advanced testing when needed. Someone comes in with some type of gut symptom or dysfunction, we can do a GI map, so stool test, an organic acids test to see if the body is detoxing, if there's any overgrowth of bacteria, fungus, yeast, and how's the mitochondria. We can do a toxin load test to see if there's heavy metals, mold toxins, or BPA and parabens. And one of the coolest ones is a food sensitivity test. A lot of times patients come in, they have high inflammation, they don't know why. We run a food sensitivity test and we see that they're highly reactive or having a reaction to a food that they're eating commonly and not really even noticing that it's triggering them. Because the difference, little tangent here, between a food allergy and a food sensitivity is that a food allergy you can die from. You eat a food that you're allergic to, your body goes into full-blown anaphylaxis, you could die or have severe complications. Food sensitivities are harder to catch because oftentimes these symptoms don't trigger until 1, maybe 2 days later, at which point you've probably eaten another 5, 6 meals. So then you have sensitivities on top of other sensitivities. You're not sure what food's causing it because you're eating diverse, and the eczema, the gut issues, the brain fog, the inflammation, you don't know where it's coming from. And so we're not over testing, right? We are just running what is necessary. And so we're always going to do a targeted investigation. We're going to go based on your story, your symptoms, your goals. What have you tried before? And we're going to build a custom targeted investigation based on that. Then step 2 is you're going to build a personalized map. Once we get the data, we don't just throw a bunch of medicine at numbers, right? And we don't just throw a bunch of supplements at it either, or else we're just doing the same thing with a natural spin. So we reverse engineer your health from the inside out, right? What are the root causes? Are you overstressed, right? Is your lifestyle causing havoc on your body? Are there toxins in your home or your environment? Do you have gut issues or hormone issues? Then we support the system. So the nervous system, the mitochondria, we detoxify the body. And then we talk about lifestyle alignment, nutrition, sleep, movement, mindset, the 4 big ones. We don't just throw a bunch of supplements at the wall, hoping something's going to work, taking the same approach as Western medicine. We use custom protocols based on your labs, your biology, and your lifestyle, most importantly. I'm not going to recommend something to somebody when it's going to add more stress to their lifestyle. Then it's just becoming a hindrance. So we work within the confines of what you can do to an extent, right? Like we're not going to be lazy either. And so step 3, we work with a team that gets it. most primary care doctors don't have the time, the tools, or really the training to interpret functional labs. It does take time. And so we're very diligent about taking that time. We often have 2 or 3 doctors looking at the data of your tests, comparing things and giving their thoughts before we come up with a program. And so with Total Care, which is our flagship primary care functional medicine program, you get advanced labs, you get functional medicine approach, you get one-on-one coaching, the data, the deep dive data, and the roadmap, custom roadmap to get you back to optimal health. And so our goal is not just health care. Our goal is health ownership, because ideally, if you can take responsibility for your health and you can take action, then we can help you. If someone's not ready to take action or take ownership that their health is really their responsibility first, we can't help you, because I can't care more about your health than you do. And so that's the firm but loving approach that we take at Alessi Functional Health. You deserve more than just vague answers. You deserve some clarity, strategy, and really someone who will ask better questions. So if your body is whispering or it has those telltale signs starting, don't wait for full-blown dysfunction. Get testing, read between the lines, and take back your health. And so if you would like, in closing here, if you would like to learn more about how we can help diagnose, reverse, and heal chronic disease within our functional medicine programs, go to alessifunctionalhealth.com, schedule a consultation with me or one of our other providers. Let's create a personalized plan for lifelong health. Listeners of the podcast, you're always going to get exclusive discounts and price reductions on all our protocols and lab tests. So just make sure you mention where you heard about us. This month only, August 2025, we are offering $100 off your first Total Care lab panel of over $200. It has to be more than $200 or else it doesn't really make sense. So for $100 off your first Total Care lab panel this month, just mention this episode when you're scheduling your consultation. As always, if you found value in the show, please like, subscribe, hit the subscribe button, and share this episode with someone who needs to hear it. That's how we grow this message, and that's how we change more lives and save more people from the frustrating, dysfunctional system that they've been living in. If you want to get in touch with us or be featured on an episode, share your story about how functional medicine has helped you, email us, ask@alessifxhealth.com. We love answering our patient and listener questions live. Then visit alessifxhealth.com, sign up for the newsletter so you don't miss anything that we have going on. And you can learn more about our approach to nutrition and cutting-edge therapies. Thanks again for tuning in to Health Decoded. I'm Dr. Alessi, and I'll see you on the next one.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.